Okay, then we come to the internal carotid artery. In this picture, you can see the arch, the big common carotid, the bifurcation, the external carotid with all of its branches, and on the back, this is the common carotid artery. Common carotid artery, it moves inside the carotid sheath. That is the interesting thing. That is the thing that we remembered, that common carotid artery, it's a part of the carotid sheath. But as soon as it bifurcates, the external carotid artery, it goes out of the carotid sheath, but common carotid artery continues. Common carotid artery continues all the way up in the carotid sheath and it enters the carotid canal on the base of the skull that we saw in the first lecture of the head and neck. The thing that you remember and the thing where the examiners, including me, intend to confuse their student is that they ask what are the branches of the internal carotid artery in the neck. So be very, very clear that there is no branch of the internal carotid artery in the neck. So internal carotid artery has no branches in the neck, and that's it. That's the thing to be remembered. And it moves up the carotid canal. It's basically a discussion for the vasculature of the brain, but just giving you an overview, a very quick overview. It enters the carotid canal, moves through it anteriorly, exits the upper end of the carotid canal in the middle cranial fossa between the two clinoid processes into the cavernous sinus. It runs anteriorly to the cavernous sinus, makes a loop between two clinoid processes, then it gives rise to its branches. The one that is going to the eye, ophthalmic branch, the anterior cerebral, the middle cerebral, the posterior communicating, and the anterior choroidal arteries. So these are the branches, but I'm not going to discuss them in detail. I think I have not written the here there is also anterior choroidal. So there is a choroidal artery also. So what are its relations? इसके किस किस से ताल्लुकात हैं? So common carotid artery gives rise to the internal carotid artery. So what are the structures that are lying posterior to it? What are the structures lying anterior to it, lateral to it, and medial to it? As it's lying on the angle of the neck, we usually combine the relations that are present on the lateral and the anterior aspect because the sternocleidomastoid and these structures are passing like this on the lateral aspect and the anterior aspect also. So let's look at the back. On the back, there is running of the this nerves. There is a sympathetic chain that is running on the back of it, and there is on the posterior aspect the superior laryngeal nerve that is running behind it because the vagus nerve is running on the little posteriorly to it, and the other muscles are behind. The relation that you must remember about the carotid canal is with the internal jugular vein. The internal jugular vein is always lateral to the internal carotid artery. Not always, technically, on just in the base of the skull where it's exiting the base, the artery is anterior, the vein is posterior, but they quickly change their dynamics, and as they go down, the artery is medial and the vein is lateral, and the vagus nerve is in between them throughout. And this relation is very important from the clinical aspect because there is a lot of times you have to cannulate the internal jugular vein for venous access, for myogenic central venous pressure, and even to pass the catheter to the heart to various procedures. So you palpate the common carotid artery, you palpate the internal carotid artery, and you pass the cannula just lateral to it into the internal jugular vein. So this is one of those relations that is not forgivable if we forget them. On the medial aspect, on the inner aspect, the ascending pharyngeal artery is there. On the lateral aspect, majorly the branches of the external carotid are coming in front of it. Like you can see the hypoglossal nerve. This hypoglossal nerve is passing lateral aspect of the internal carotid artery, and the ansa cervicalis, I think almost all the veins like all the veins like facial vein, lingual veins that are making the common trunk, the thyroid veins, inferior thyroid veins, all of these are crossing the artery laterally, and a lot of the nerve branches, the chief one including the hypoglossal nerve and this ansa cervicalis, and of course there is a lot of pharyngeal laryngeal branches. Actually, that is not the branches of the cervical plexus, basically pharyngeal plexus. Here you can see pharyngeal plexus. So they are moving across the lateral aspect. So there are a lot of structures going on the lateral aspect. You can remember them: internal jugular vein, vagus nerve itself, lingual facial, ascending cervical. And you move up, you can see the belly of digastric moving on the lateral aspect. External carotid artery is on the these are all of these muscles arising from the mastoid and the stylotosis. These are on the lateral aspect of this artery. So internal carotid artery, the branches. So we are moving here to the last branch, last artery that is important. I won't be talking into the detail the relations very much, but I will be talking about their branches.